As you know, prenatal exposure to alcohol can result in brain injury. Let's review FASD, fetal alcohol syndrome disorders, and FAS, fetal alcohol syndrome. In this section, we are going to take a closer look at the brain injury and its effects. This screen shows MRI scans of the developing brains of two 13-year-old boys. The one on the left shows the brain of a typical boy with no FAS. The one on the right shows the brain of a boy with FAS. Take a look at the corpus callosum, the white structure in the center of the brain. Notice the difference in length and width between these two boys. Neuroscientists explain that the corpus callosum is a thick bundle of fibers in the center of the brain that separates the left and right hemispheres. It helps the two hemispheres to communicate with each other. Often, children with an FAS have retained information in one hemisphere and are not able to access the information they need if the corpus callosum is not firing properly in the moment, especially during times when the child is stressed or anxious. This damage is what makes children with an FASD very inconsistent. One day they might know how much toothpaste to put on a toothbrush and not the next day. One day they might know what 3 times 2 is, and the next day they might not. These inconsistencies can even change minute to minute. This is one of the reasons it is so important to understand the brain injury perspective of children with an FASD. Otherwise, it is too easy for parents and caregivers to assume that the child is lazy or not trying hard enough, or even trying to act incompetent. Note that many of the structural abnormalities that can be caused by FAS do not show up on a regular MRI, yet many of the children still have brain functional impairments. For some children, it may be difficult to get a clear diagnosis. However, when history and developmental functioning suggest the symptoms consistent with an FASD, parents may choose to adjust their parenting style to better meet the emotional and behavioral needs of the child. In addition to inconsistency, which we just discussed, the other common challenges for children with an FASD include symptoms listed on this slide. Please note that an example of working memory struggles is difficulty remembering and being able to put memory into action, such as remembering the steps of a recipe the child is currently using, or not retaining or being able to carry out simple multi-step directions. Now let's do a quick activity designed to help you understand how children with an FASD might manage in school.